Whistleblower protections ensure that individuals can freely report on substandard and unsafe work conditions without fear of retaliation. Today, Jacob and I, Susmita, at the Health Law Institute, will discuss some of the hazards faced by pharmacy staff in the United States during this pandemic and try to offer an overview of the regulatory landscape, available resources, and limitations. COVID-19 has exposed frontline health workers, including community pharmacists and technicians, to preventable hazards. If not managed properly, these lead to unsafe working conditions, jeopardizing not only the health of the pharmacy staff, but also the patients they serve. As of September 4th, there have been 151,998 cases and 672 deaths among health professionals. Data is not broken down into health worker categories. However, given the conditions of work, the proximity to patients, and the fact that most pharmacies are part of larger retail locations, we can be sure there are casualties among pharmacy staff. Even after a pandemic was declared on March 11th, conversations with pharmacy staff suggested that there was a lack of protection. There had been no form of risk communication from management, not even an email. Masks had not been provided. Patients were still coming into the pharmacy and sitting in the waiting area. Consultations were still being done at the pharmacist's consultation window. There was no limits on how many people could enter the store, indirectly exposing the pharmacy staff. Some pharmacies had been given disinfectants and cleaning supplies and vaguely asked to clean more often, but no comprehensive and clear policy was put in place. In many instances where pharmacy staff approached management, they were ignored and concerns were not addressed. Some workplaces even organized initiatives such as casual workdays, but did not address health obligations. A lot of staff were worried about getting infected, passing it to their family members and friends, and apprehensive that they will not be able to take sick leave as their stores are perpetually short-staffed. Independent pharmacy staff seem to be faring better. They had masks and disinfectants, utilized the drive-thru whenever possible, and limited customers into the store and around the counter. As the pandemic has progressed, some safeguards have been implemented, but pharmacy staff continue to be exposed to unnecessary risks. There are reports of pharmacy section not being cleaned, along with the storefront, when a store employee tests positive, even when the employee has worked in the pharmacy. Upper management from a chain pharmacy has been exposed, instructing employees not to tell patients that their medications were filled by someone who tested positive. Threatened with disciplinary action or termination if they told customers a staff tested positive, and instructed employees not to get tested when a co-worker showed symptoms and tested positive. Currently, there's a case filed in New Jersey against a retail location, which also has a pharmacy, for failing to enforce social distance guidelines and failing to limit the number of customers. With the upcoming flu season, there is even more cause for concern.
All workers have a right to safe working conditions as embodied in the Occupational Safety and Health Act, also known as the OSH Act of 1970. The best case scenario is being able to eliminate hazards. However, this is not always the case, especially in the current situation. The next steps should be to provide engineering controls such as isolation rooms and other physical barriers, put in place administrative controls and safe work practices such as limiting access to patient care areas, effective sharps management, and worker training, and provide personal protective equipment such as gloves, gowns, goggles or face shields, and N95s. Employers must provide most protective equipment free of charge and are responsible for knowing when protective equipment is needed. The OSH Act also accords employees the right to see information that employers collect on hazards in the workplace, know what hazards are present, and be informed on how to protect themselves. If any training is required for these purposes, workers must be compensated at their normal rate of pay. Employers are required to keep a log of all recordable incidents and post a summary of the injury and illness log from the previous year in a place where workers can see it. Workers and their representatives have the right to receive copies of the full OSHA Form 300 log. Following a request, employers must make copies available at the end of the next business day. When these protections and controls are not put in place and employers are not responsive to concerns, a worksite investigation by OSHA can be requested. OSHA covers most private sector employers, either directly through federal OSHA or through an OSHA-approved state plan. State-run health and safety plans must be at least as effective as the federal OSHA program. As most community pharmacists and technicians work with private employers, they would be under the jurisdiction of OSHA. These whistleblower protections are also meant to protect individuals from retaliation. However, it's important to note that these filings have to be made within a certain time. You must file a complaint with OSHA within 30 days from the date of the retaliatory decision. Other options that can be utilized are state-specific whistleblower protections, or if there's a concerted refusal to work in unsafe conditions under Section 7 of the National Labor Relations Act. Under the latter, there is 180 days to file a complaint. Recently, some states have enacted specific whistleblower protections in light of the pandemic. Colorado, for instance, bars employers from firing workers who raise safety concerns related to a public health emergency or who choose to wear their own personal protective equipment. Philadelphia also included a ban on retaliation against employees who raise workplace safety concerns. Virginia not only included a ban on employer retaliation against workers who raise safety concerns with employers, but extended these to the employee communicating with a government agency or the public via social media or the news media.
OSHA has been criticized for failing in its responsibility to assure that employers keep workers safe. First off, the guidance it has issued for retail pharmacies is only advisory and not mandatory. Therefore, there is no enforceable COVID-19 specific requirement on practices and policies that employers must implement. This is also true for the guidance released by the Centers of Disease Control, CDC. In general, there seems to be a disconnect between recommendations for the general population and those for health workers. The CDC advises people who have been exposed to coronavirus to quarantine at home for 14 days. But it recommends exposed essential workers may continue to work as long as they're asymptomatic and precautions such as wearing a mask are taken. For older health workers and those with pre-existing health conditions, there does not seem to be any specific guidance, though we are aware that these individuals are at higher risk of contracting the infection. Further, it has been reported that OSHA has not been conducting any on-site inspections or enforcements when workers reach out. The recent Department of Labor report from the Office of the Inspector General noted that whistleblower complaints to OSHA are likely to take longer to resolve because of the high number of virus-related claims and a limited number of investigators. A COVID-19 litigation tracker reported a 30% increase in complaints over the same time last year and noted that 39% of whistleblower cases are COVID-19 related. These developments suggest a need for pharmacy staff to be aware of their rights and available resources. The uptake of social media networks as an information sharing tool to keep abreast developments from colleagues and to contribute to the conversations of improving working conditions seem to help overcome many of these barriers. The pandemic clearly reveals the need for stronger whistleblower protections, as evidenced by state-specific laws. Good practices such as virtual consultations, using drive-thrus, safer COVID-19 testing and immunization programs should continue to be developed and implemented. Certain categories of pharmacy staff, such as older individuals and those with pre-existing conditions, may need additional mandatory protections. Compromising the health and safety of pharmacy staff eventually compromises patient safety, quality of care, and can lead to spread of infections in the pharmacy and the community at large.